Hello and welcome to the first episode of Conversations in Care, hosted by VNA Hospice of the Southwest region. My name is Heather Brouillard. I am the Community Liaison for VNA Hospice, and my guest today is Michaela Fizzette, the Director of Communications for VNA. Today we'll be talking about VNA services. We'll do a brief overview of our services, and hopefully you'll gain an understanding of how individuals and the community can benefit from all that we do. We also have some big things happening this year at VNA. We are celebrating our 80th anniversary, and we are also undergoing a rebranding and organizational name change. So we'll talk about all the exciting things happening as well. So let's jump right into it. For viewers who may not be familiar with VNA and Hospice, can you start by giving us an overview of who we are and the services we offer?
Absolutely. So we are your local home health and hospice agency here in Vermont. We cover Rutland County, Bennington County, and Franklin County, which is really exciting. We have quite a large reach across Vermont. Our mission is to enhance the quality of all we serve, and that's through comprehensive and community health care, which means we're going into their homes. We're serving people at their most vulnerable times and making them feel comforted. Our vision is to be the best provider in home health and community-based care here in Vermont. And really, you know, our health matters are what guide our decisions every single day.
So VNA and Hospice has been a part of this region for quite a long time. Can you talk about the history of the organization and why it's remained such an important part of our community and our healthcare system in general?
Yeah, so it's really an amazing history that VNA has had here. We started in 1946, 80 years ago, and it was just a handful of people in the community that saw a need to continue home health at home and help their neighbors live as independently as possible. So they started actually servicing more of the home health side of things. Then in the 1900s, that's where we started to see more pediatric care. Hospice volunteers merged with our home health nurses that were doing this work. And so we started to see the agency really take some ground here, particularly in Rutland. In 2007, that's where we started expanding more regionally. So that's where Dorset came on board. In 2014, we had Bennington County come on board. And just in 2024 is actually when we started servicing Franklin County. So really, ultimately what we're trying to do is bridge that gap from the hospital or a specialist to home health and getting people back onto their feet or providing comfort in terms of our hospice services.
Wonderful. Our mission is really at the heart of everything we do. Can you explain what our mission is and how it guides the work we do every day?
Absolutely. So again, we really want to enhance the lives of everyone we serve, and that's through comprehensive and community health services. I think that's something that is really remarkable about what we do is that, one, we're local. I see, the clinicians in the grocery store, they're shopping here in the facilities. They're all over the community. So it's really not a large corporation. We might be a large nonprofit, but we really have that local spirit. And I think that's so incredible. As someone who's not necessarily from the state, I moved to Vermont 5 years ago. It's amazing to see the amount of staff that have been born, raised in this county or this town, and they've never left. And it's so beautiful and wonderful to me. And I think that really adds that extra special value to our agency. I think another thing that is so amazing is the charitable care that we provide in the community. In other words, that's non-reimbursed care. And what that means is that we don't say no to anyone, despite their finances, despite their insurance carrier. We are there to provide them services. And, I think our board president, Dan DiBattista, said it best that if the state somehow changed the rules, changed the regulations, changed how, the program worked, we would still care for those people. That's just at the heart of what we do. We have some incredibly empathetic staff and some incredibly mission-focused staff. So I think that we'd still continue to take care of those people, the most vulnerable, even if we didn't have to.
One of the strengths of VNA is the team approach to care. Can you explain what that multidisciplinary model looks like?
Absolutely. I think what's amazing to see is just this collaborative approach between all of our teams and among the hospitals, the facilities, the family, the caregivers. It truly is this team effort. It's really great because we are collaborating within each county. So Rutland County, they have their nursing meetings, their rehab meetings, their clinical meetings, but we're also collaborating across all 3 counties to make sure that we're all providing that same skilled and compassionate care. So it really isn't just the patient and, whoever the clinician is. It's the patient, it's their family, it's their caregivers, it's the doctors, their specialists. It's really all of these people merging into this one unit to make sure, especially here in Vermont with isolation, nobody feels like they're alone. They really have this solid core of people. And with our hospice program, that includes a whole slew of volunteers that do some amazing work that we can talk about a little bit. But what's really great is that, again, we're this one team, one dream kind of mentality.
Love that. Let's talk about the specifics of the services we provide. Many people have heard the term home health, but may not fully understand what it means. What exactly is home health, and why might someone need it?
So oftentimes folks are either hospitalized or they're in a facility from an injury or some sort of chronic illness or disease, and really what happens is their doctor makes a referral to continue that care inside of their home. And what's great about that is patients are a little more motivated, they're more comfortable, they're feeling a little bit more independent to take that plan of care into their own hands and work with our team. So really our goal is to treat this illness or injury while helping them regain their independence, particularly in their home health services. For hospice, that's a slightly different plan, but we want them to become as self-sufficient as possible, and that really makes sure that they're an active part of the plan of care, their caregivers are involved, they really want to get better, and oftentimes we're saying, hey, can you show us what we taught you to do last week, or can you, recite back, some of the med management that we had you on. So typically, this is where we're also doing home safety evaluations and making sure that they're adapting to either their environment that they're in, or we're adapting their environment so that they can heal safely at home.
What kind of professionals might visit someone in their home through home health?
Oh, we have a whole group of different professionals. We have our skilled nursing team who are just absolutely amazing. We have a variety of therapists. So we have physical therapists, we have speech therapists, occupational therapists, and they all serve slightly different purposes there. We have aides, we have social workers, we have volunteers. What's great is that the initial visit will be the admission, and they'll go thoroughly over the entire plan of care. They'll do the assessment, and then they'll plan out basically who needs to be involved. And from there, that's when the scheduling happens, and it's a huge collaborated effort. It happens in the patient's home, it happens behind the scenes at the office, so they might see a handful of those people even within a week or two, which is just amazing. Again, particularly for people who feel maybe isolated, it's that team approach so that hopefully they don't feel as alone.
Can you give an example of a common situation where home health might help somebody recover safely at home?
Absolutely. So actually more recently, I heard from a caregiver whose husband unfortunately slipped. I mean, especially this time of the year in Vermont, black ice is so common, and he had to have a hip replacement surgery, and took some time to heal in the hospital, but then wanted to continue the healing process at home. So that's where we actually had a couple of our physical therapists going in on a regular basis to check on him, make sure he was doing well, but then come up with a plan of care to get him back on his feet again, because now driving's uncomfortable, even just moving from one side of the house to the other was uncomfortable. There's a little bit of nervousness with his bearings, walking outside. So they've been really teaming up to make sure that he's comfortable simply getting out of bed in the morning, because that could seem like a huge feat. So that's one example. There's countless different stories, and as time goes on, we see more patients with more complex situations and needing more care. So that's a very simple one in the best way possible. So it really is just amazing, because they're able to safely adapt in their home. It's not they're in the hospital and then now they need to reprogram their brain to go, okay, this is how I would handle it in their house. They're practicing it, they're living it, they're getting reacquainted back in their own home.
Wonderful. So you mentioned therapy services. Can you talk about the role of physical therapy versus occupational therapy and speech therapy, and how they might work together to help somebody maintain independence?
Yeah, so speech therapists, so contrary to popular belief, they actually do a lot more than just treat stutters and lisps. They work closely to evaluate the patient and basically see what remedy of care they might need for either a disorder or a delay. And that could include, voice disorders, swallowing care, even memory improvement, oral motor and oral feeding issues, any sort of like cognitive impairs or delays. So they're really focusing on that. And that includes adults and pediatrics. I think another big part of all of this too is just knowing that we also have these programs for our pediatric patients as well. Occupational therapy, actually, I did a photo shoot with one of our occupational therapists, and one of the things that she said was that a lot of times people think occupation like in terms of a job and not just your home, occupying your own life and activities and day to day. So it was really interesting just to kind of hear that perspective. But really, they're working on the physical, emotional, and social issues to regain that independence. And that could be anything from either it's a traumatic injury for rehabilitation, stroke rehabilitation, functional capacity evaluations. And then our physical therapists, they come in for kind of what you would expect. They're regaining strength, some of that mobility, and again, more independence for your daily activities. So that's going to be exercise and walking and medical equipment assessments. What I think is remarkable is, a lot of times you take a lot of what you do every day for granted, and then going into some of the homes and seeing some of these patients and our staff working together just to make opening the cabinets easier in the morning, or using, cutlery to eat better, or taking a lap around the driveway just so they feel more grounded in their footing. It just makes it gives you that perspective. You can't take anything for granted. So it's really great that they're all motivated to get back on their feet and get independent again.
Wonderful. So 2 other services that we offer are hospice care and palliative care. And sometimes when people hear those words, they can get confused about what they offer. Can you give us a little bit of an insight into what palliative care is versus hospice care?
Yep. So palliative care, actually the word palliate means to relieve symptoms of pain and suffering. So for palliative care, typically these are for patients that have a chronic disease or illness, and they're still seeking curative treatments, but they want comfort, care, and they want support. So this would be someone with a life-threatening illness, but they are seeking extra treatment. And really it's some of those instances might be, cancer, heart disease, kidney failure, ALS, MS. So there's a variety of different folks that would benefit from that. And really, again, that's just, it might be some volunteers, it might be physical therapy, occupational therapy, just, again, maintaining comfort while they're at home. Where hospice is, the patient has a 6-month prognosis. So, and they're not seeking curative care. They are just seeking comfort in the final stretch of their life. And unfortunately, we're seeing patients that are referred to hospice probably a little later than they would benefit from. Because really with hospice, our team often is called the angels that come. I mean, there's just so many amazing reviews of our hospice team and how they've positively impacted the family, the friends, the caregiver, and of course the patient's lives. And with hospice, we work directly with the physician, any specialist to come up with this care plan. And of course, that's very similar in all the other instances that we do, but this can involve med management and, empowering the caregiver to be able to provide medicine to their patient. They get a whole group of volunteers that come with a whole bunch of different things that we can talk about. They're getting regular checkups to make sure that vitals are good and everything like that. So, it does require a referral from a doctor, both programs, but I think the biggest thing is that sometimes people think it's either hospice or palliative care. Sometimes, you might start on palliative care and then transition to hospice. Those are some of the differences right there.
Great. So you did mention that hospice provides supports not only to the patient, but also their families. Mm-hmm. Can you describe a little bit how we support the families through this process? Oh, yeah.
I mean, caregiver could be a full-time job, especially if you have a patient that's been put on hospice or is in their final days of life. And it's an incredibly emotional time. It takes a lot of coordination. And then on top of it, you have to care for yourself. You have to make sure that you're well enough to be able to provide the care to your patient. So what's great about, the team approach is that there are these group of volunteers, and they are just people with hearts of gold. I mean, there are so many wonderful services that they provide. So one of the biggest ones is our Dinners with Love. We are so blessed and so lucky to be in the communities that we're in because We have restaurants that participate on a weekly basis, and they decide whether it's one meal or 2 meals that they donate to our patients on hospice and their families, which is amazing. So we have volunteers that will go to the restaurants, pick up the meals, and deliver them carefully to the patients and the caregivers. So that's just one example. We also have respite care. So a big thing is just having another person in the room, just not feeling like you're alone with your patient. And so we have hospice volunteers that will go and just sit. They might step in and say, hey, do you want to take an hour, go grocery shopping, go just sit in the other room and process, just do whatever you need to do. And they're there to just sit with the hospice patient. So that's incredible. I mean, again, just that valuable time that you might need, especially as a caregiver. They'll also help with some homemaking, grocery shopping. They recently, actually, Equinox Mountain in Bennington County opened up their Sky Ride to free rides for hospice patients. So some of our hospice volunteers can certainly take them for a ride, enjoy the views. How lovely. We have we are on our veterans program as well. So veterans are paired usually with people in the same branch as them, just so they can have that commonality and talk about very similar stories. But definitely want to take time to honor our veterans that have done so much for us, our country, and have them have a nice peaceful passing as well. We have 3 choirs. I would be remiss to not talk about our 3 choirs. They are amazing. We have our Serenity Singers down in Bennington County. We have Trillium Singers here in Rutland County. And then we have Heart Sing up in Franklin County. And the one story that I always like to mention to people, because it always just sits with me when I think of these choirs, is I had a patient, or a caregiver rather, approach me at Arlington Farmers Market, and it was one of those events that you're just there and you're just there for awareness, but a lot of people want to come and share their story, and they said that they never thought they'd describe death as beautiful, but our hospice singers were there as her mother was passing and was basically singing her into her next life. And it was so beautiful, like got immediate chills. It was something that, again, you just don't think about. But these choirs, they sing songs from, the 40s and 50s and 60s, kind of in the times when a lot of the patients currently those are their childhoods, and they'll sing a variety of different things, and it's absolutely beautiful. So it's amazing, just all of the different support that's provided. And then outside of that, we have advanced directives planning, so people can start thinking about, what they would like to see at the end of their life. That's so important, letting the people know what their wishes are to ensure that they have exactly what they envisioned in their final days. We have our Death Dying Danish clinics that happen monthly in all 3 of our counties. Our volunteers are absolutely amazing at putting those on. And really what that is there's no agenda. You can enjoy pastry if the facility offers food. Sometimes they're at the library, so not always are there pastries. But it's just a conversation to just talk about death. And I think that sometimes it's like one of those words, like we don't want to talk about it. It's kind of that stigma, that taboo word. But it's so interesting just to sit in these conversations and hear the different perspectives that people have. Some people wanted it to be quick so that they could just get it over with, and they were very pleased when their loved one passed. Some enjoyed the longer time with them and processing it a little better. Some people want to know, some people don't want to know. It's so interesting just to sit and literally just talk about death and what that means to people, and all different ages attend. Folks that are grieving can come. They might want to get bereavement first because sometimes it can be a triggering event, obviously, but it's just amazing, again, the support that we have here in the community for anyone really that needs it. So
wonderful. So 2026 is a particularly exciting year for VNA and Hospice. This marks our 80th anniversary in the community. Can you tell us what reaching this milestone means for our organization?
Oh yeah, I mean, it's absolutely incredible. I mean, I think that it is just so remarkable that this organization has stayed strong through 80 years and it has expanded through this time. It's a true testament to the people that have been working here. So every year we do an employee recognition dinner, and that's where we go over everyone's milestones. You got the 5 years, the 10 years, 15 years, especially in this day and age is a true, amazing feat. We have people that have been here for 40 years. I mean, that's half the lifespan of this agency. That is incredible. Like, people that have just day in and day out have been here for 40 years. And I mean, there's a handful, and then the next layer is 35 years, and there's an even bigger group of people that have been here that long. It is just, you just don't see that these days in a lot of businesses and a lot of agencies. And I think that that's just amazing. You know, the culture here is so wonderful. You see people just coming every day and giving it their best because they truly care. I mean, and some of the homes aren't necessarily like the greatest experiences, just to call a spade, but you know, it is amazing because they really do care about the community. And that's, I think that that's just been kind of the heart that's been beating this entire time. So to celebrate 80 years, we have a lot going on, and you've been a big part of it too, which has been amazing. So we are doing 80 ways to show up for the 80th. And our goal is to, and I know we will do it because last year I think we were close to like 75 events, but we're doing 80 different events in the community, all 3 counties that we serve. Everything from, you know, again, our Death Dying Danishes clinics, to Friday Night Lives, to the Council on Aging community days, to the various expos that are going on. However we can reach the community and continue to provide education, to continue to provide support and more information. That's exactly what we want to do, to feel fully immersed in this community that has supported us so wonderfully through the years. So we're really excited. We've been releasing a press release every single month highlighting different things that we have going on. You know, again, highlighting some of those clinician stories with patients that have been working together for years and years and years. That, I think, is another just remarkable thing that we have for us. So, yeah, it's a big year. I mean, it's amazing. We're excited to be out there in the community. You'll see our custom shirts that we have on, 80 ways to show up, 80 years strong. So stay tuned for more excitement this year.
There's also another big change happening with our organization this year. We are undergoing a rebranding and organizational name change. Yep. Can you tell us a little bit about that and why it's important for us to update?
Oh yeah, this is, I get very excited about this topic. So after 80 years of serving Vermont families, it's time for a new name and that just better reflects who we are, really. So we're the same agency that everyone has trusted since 1946. There really is nothing changing. There's no large corporate takeover. We're simply realigning our brand, our identity, our name to reflect who we are and the communities that we serve. It will reflect the heart of what we do, the people we serve. It speaks to our Vermont roots. It speaks to our commitment to the community. And really, it in such a short name, it covers more of the full spectrum of the services that we provide right now. You know, we do have an incredible team of nurses that goes out there, but we have therapists and aides and so many other professions underneath that name. So we're really excited about that. And really, it just tells a more complete story than our name before didn't. So really excited. A few people already know what it is. You know, we've told some of the chambers, the Rotaries, VNAs of Vermont. We've told a handful of people, and I think particularly for our Franklin County folks, they will love it because right now Southwest Region does not describe them being the farthest northwest in the whole state. So I think they'll be very pleased to see this new name, and it's one that I know will last the next 80 years.
Before we wrap up, if someone watching today thinks they or a loved one might benefit from our services, what should they do?
Well, the first step would be talk to your doctor. They're going to be the most knowledgeable. You know, hopefully at that point we've given them all the documentation and information that they could possibly need, but they're going to be the one that's able to make that referral for our services. But next, I mean, if they're curious right now, just go on our website. It's vermontvisitingnurses.org. It has all of the information with all the different services we provide and more details as to maybe what you might qualify for. And then you can also give us a call. Our phone number is 802-775-0568. We have a real person that answers every single time, and they are wonderful. So you can give them a call. They'll be happy to point you in the right direction. Maybe it's a call to a clinical manager. Maybe it's just more information or services to ask your doctor about. But I would start there. You know, we're happy to help in any ways that we can.
Wonderful. Well, Michaela, thank you so much for joining us today and telling us all about the amazing work being done in our community. And thank you to everybody watching. If you'd like to learn more about our services that we talked about today, or events happening for our 80th anniversary or rebanding, please check out our website. I'm Heather Brouillard, and this has been our first episode of Conversations in Care. We will be coming to you each month, bringing different healthcare topics that concern our community. Thank you. See you next time.